My name is Jasper Wallace, and I did my oral presentation on a book called Art Therapy in Asia, To the Bone or Wrapped in Silk. And so first off, I want to go over kind of an overview of what art therapy is. I read this book thinking I knew, and my eyes were very opened when I learned that it is so much more complex than originally thought. And so as an art therapist, what you're doing is you are creating a safe environment for your patient, allowing them to express themselves artistically with the materials of their choice, helping guide them through the process when they need it, observing the expressions that they have while going through the art therapy process, making assessments of them, and then documenting that. Materials they could be using, there's quite a bit of different things for art therapy, everything from drawing to painting, sculpting. You could be using clay or other materials, creating a collage, photography, and so on and so forth. So a wide array. And then the assessment you would be making has to do with how the individual is moving and working with their material of choice, the rhythm that they're using, the tempo that they're using, also the degree of relaxation that they have or do not have, and also degree of concentration. Their participation, whether they sustain their participation the whole time or get frustrated and give up earlier. And then also that the patient can describe their experience on an emotional level of how they felt creating that piece of art. And then also at the end that they can describe to you that piece of art and its meaning. And then how art therapy heals is that it causes your patient to face their fears and face those things that they have resistance with and their inhibitions. And that in turn causes a transformation and a healing effect on an emotional level and also on an energy level. And so overall what it does is emotionally it opens them up, it emotionally engages them, helps them build confidence, helps them manage their emotions, and so they can go on. And it says in the book that they can reach relaxation, but I think that would depend on the status of your patient and what they're hoping to achieve. And so this book works with many different countries. Basically what it was trying to do was take art therapy that's developed in Western society and bring it over to Asia and see how different areas of Asia assimilate or how they take in the way that the Western medicine does art therapy and how it also gets developed through how they take it in. And so what we learn over there in Asia and how they use art therapy, we can bring over back to Western society and try to better our ways of doing it. And different countries that they went to were anywhere from China, Korea, Hong Kong, Japan, the Philippines, to Cambodia, Taiwan, Thailand, Singapore, and India. And in these countries, they focused on, it could be just general, like in China, they just focused on general information like the body, mind, and medicine aspects of that culture. In Cambodia, they focused on political and societal trauma that people had faced there. They focused on disaster relief in the Philippines, and then all the way over to sex trafficking survivors in the Southeast Asia. And so that's just to name a few things that they brought art therapy to see what its implications would bring out. And so from there, the concepts that I chose, my first one's socialization. And socialization, of course, is a process where someone learns the norms, the values, the beliefs, and the social skills. They learn interpersonal actions and how to interact with people in their society, but also in a more personal, friendly atmosphere. And so that was my first concept, and I chose that because socialization has such a big impact on one person, and then also recognizing that even though someone's within the same culture, that their socialization and who they are and what creates them can vary between those people, and it's something good to keep in mind, because art therapy within itself, whether you're from one culture or another, or even siblings in the same family, is that you're creating something that is very individualistic. And so The next one's cultural competence, which enables people between different cultures to work together where you are valuing the beliefs of your client or the other individual. And then the third was folk medicine versus traditional medicine, and that kind of back and forth that takes place. And so when we look in Langer's Sunrise Enabler that was presented, it's one of the transcultural models. We do see that socialization, of course, is made of so many key things, everything from education to economics, political and legal factors surrounding that region or country, the cultural beliefs and values and religions of your family and your friends, the social factors and dynamics of your family and friends, and it can even all the way go to technology that is or is not present within your region, your country, or even if your family lets you have those type of things as well. And so socialization, just important to keep all those things in mind when you are working one-on-one with it, or even in a group, just noticing that that person is an individual. And then culturally, has to do with everything with socialization as well. Cultural, we tend to put people under one umbrella, but it's important to keep in mind that those people within the one culture can differ. And in the book, it does talk about the cultural implications. It was very interesting that when they brought these art therapy practices to Asia, that some of these countries, it is seen as threatening to the society that a person would express their personal conflict or negative feelings. And so how you implement that can be a touchy subject. But in other cultures, it is seen in a more positive light. If you're Buddhist, Taoist, yoga, those type of beliefs, a few things that they center around are being present in the moment and then limiting the spoken language, so they grasp the significance of art therapy very easily. And then in India, they encourage use of all your senses and how they interrelate and then artistic display. And so they also took on art therapy in more of a positive light with less conflicts in it. And so that's just interesting to note. And then in regards to the folk medicine and traditional medicine, it was an important question the book brought up is, and this was also the study and the reason for the book, was bring people that are trained in North America, Europe, and Australia over to these other countries like Korea, Japan, and so on and so forth, and how they implement art therapy in these cultures that are different from their own. And it's important to note that the art therapist, when they're having a session, even though it has a Western kind of outline that they're following, the therapist can choose to relate the actual art therapy individually and culturally. How it's delivered, even though you're following a set pattern that's outlined by Western society, how it's presented can have a big impact. And so from there, I don't have any recommendations because I didn't know, I thought I knew quite a bit about art therapy, but it turns out I don't. So reading the book for me was more of getting a good general base of what art therapy really is and what it can do. So I don't necessarily have recommendations. The book poses a lot of questions which it brings up are very important to get dialogue going between all the countries all over the world of art therapy and how it's implemented and how each country can help the other by just noticing the different ways that they do go about handling and implementing art therapy. And then I wasn't necessarily frustrated at all, maybe that I didn't know more. And then I wish I could have had a better base. Maybe if I read the book again, I'd get more out of it in terms of details. I have time constraints with nursing school right now to be able to do that again. And then surprises, not necessarily surprises, but really interesting is the fact that what they found from Asian tradition, one little thing is that Western society, when they're trying to get someone to develop their own natural expression, they tell them to do linear scribbles. But in Asian tradition, they found that people doing spontaneous and minimal brush strokes actually allowed people to develop their own natural expression better. So we can definitely learn things from other societies. And so this book was very fascinating. And the last thing I'd like to say is that the book was pointing out that it's important all the people that were critiquing it saying it was very important because it's helping bridge that gap between Eastern and Western societies in regards to art therapy, because Eastern scene is very holistic and Western scene is very individualistic. So the reviews on it were very good in terms of opening up dialogue and allowing different countries to learn from one another. Thanks for listening.